Welcome to Desert First Aid. This training will consist of some of the most common first aid situations that you may encounter when you are volunteering in the preserve. The information contained in this training is to help you better manage a situation. We want you to know that by no means are you obligated to administer any help beyond your comfort level. If calling 911 is the extent of what you can do, that is great. It is something, and that something will benefit the patient. As a steward, you have most likely signed up for this volunteering position because you are a helper. We appreciate this and that we can rely on you to help. As a steward, you may often be the first person on the scene of an emergency. You may find yourself disoriented, confused, and scared. The most important thing that you can do is to help to manage the situation. People in general often will not help someone out of fear that they will later be sued. If you or anyone else provides first aid assistance to the best of your skill level and training, the Good Samaritan law will protect you from a lawsuit. It is important that you maintain a sense of process when on the scene of an injury. Following these 3 steps will result in a better outcome than if you go into an emergency situation without a plan or process. Your role is to manage the situation. If you skip this step, it could put the patient or you at risk. Before beginning any first aid, it is important that everyone at the scene is in a safe place. You are the number one priority. It is important to gather as much information as possible when you call 911. This will help the dispatcher to provide the best possible care by providing the proper emergency units for the emergency. Try to get as many details from the patient, friends, and family members, and any witnesses who may have seen what occurred. When you call 911, it can be a very exhilarating experience. It is important that when you do so, to remember to speak slowly and clearly. When you call 911, your call will go to the Maricopa County Sheriff's Department. Once it is identified as a medical situation, you will be transferred to the town fire department. To provide the best possible service for your emergency, the dispatcher will ask you a series of questions. It may seem like a long time going through these questions, but it is not. While you are speaking with the dispatcher, they are in the process of activating the units that will be responding to the scene. Most trail rescues are handled by the TRT unit. This is the Tactical Rescue Team. They are the crew that has the equipment and training to safely get the patient out of the preserve and to a rescue to transport to the hospital if needed. Every rescue is unique, but typically the sequence of events is the following. The first unit with the medic will hike to the patient and assess the situation and start anything medical that is needed. They will radio what the scene consists of to the TRT unit so that the TRT unit has everything that they will need to assist. This easily could include a piece of equipment called a Stokes. This is a basket that has a large wheel on the front and will be used to transport the patient back to the trailhead. It also has the nickname of the Big Wheel. The TRT team will arrive to the scene, get their equipment together, and hike to the patient. There is no fee and no charge if the fire department helps you or helps an injured patient. This is something that many people are unaware of or may not believe. It may be very different in other states, but that is how it works here. The only time that a fee would be associated to a rescue is if the patient was transported by ambulance or helicopter to the hospital. A patient can be brought off the trail and can refuse to be transported. It is always preferred that the patient, if able, calls 911 or someone who is with the patient does so. With secondhand reporting, there often may be crucial details that are not included. With every situation, please get a phone number to enable the emergency personnel to make contact with the patient. This slide indicates some of the most common situations that occur in the preserve. Heat-related rescues are one of our most common medical problems in the preserve. This is a serious problem because someone can easily go from heat distress to heat stroke in a matter of minutes. As locals living in our desert environment, We know what we need to do to be prepared when hiking. We hike in the cooler times of the day, pre-hydrate before going out, carry plenty of water, and dress accordingly. Not so much with visitors from out of town. They're on vacation. Most likely they will arrive here already dehydrated, party hardy, enjoy big meals, sleep in, and then decide to head to the trailhead when you and I are probably just finishing up our hikes. Heat exhaustion leads to heat stroke. Both are serious conditions, and 911 should be called immediately. The best way to treat a heat exhaustion emergency is to get the patient into the shade and start cooling them down as best you can. Wet them down, use an emergency blanket to create shade, and apply cold packs to all of the areas where there is hair or should be hair. If they have a hat on, take it off. Let their head get some air. Fan them with the hat. If there's a crowd, or even in any situation, get everyone to stand back. It can be very suffocating when someone is on the ground. If the patient appears to be going unconscious, please do not allow any sips of water. They could easily aspirate the water. Heat stroke is an immediate medical situation. Call 911. A heat stroke patient needs aggressive cooling down, and an IV of fluids is the only solution at this stage of distress to help them recover. Diabetic emergencies can present as someone being intoxicated. The more questions that you ask, the better it will be to understand if the patient is indeed in a diabetic emergency. A person suffering from low blood sugar is a 911 situation. I recommend that you carry individual servings of gummy candy in your pack. This could save a diabetic's life. There are diabetic situations where someone may have too much sugar, which is also an emergency. However, if you give a patient with too much sugar the gummy candies, it will not accelerate their condition, where it may save the life of someone with low blood sugar. Jumping cholla does not exactly jump as indicated in the name, but you would think that it did with how many visitors tangle with it. The best tool to remove a cholla ball is by using a hair comb. Before you get between the cholla ball and the unfortunate patient's skin, make sure that you know which way the wind is blowing and that all spectators are standing clear of the direction that is going to fly. If you do not, you can easily have two patients from the same cholla ball. This is a very painful incident, and people often get really freaked out by the trauma that has occurred to their skin where the cactus was removed. Please assure the patient that there is no poison associated with the cactus spines, and the best thing to do is to wash the area with soap and water, or even soak the area in Epsom salts. The skin should heal up within a week. As you are aware, the terrain in the preserve is uneven, rocky, and slippery. The decomposed granite can feel like you're walking on marbles, so falls are inevitable. The most serious situation that can occur with a fall is if the hiker has hit their head. This could easily result in a fracture to the neck or spine. When evaluating a fall, always ask the patient if they have hit their head. If the answer is yes, or when you are conducting your scene size up and it appears to you that they have, do not move the patient. This is a 911 situation. The help that you need to administer, if this is the situation, is to do a stabilization to the head, which is referred to as holding C-spine. To do this, you will need to do the following. Kneel at the top of the patient's head. Bend both arms in a 90-degree angle from the elbow. Place both arms on each side of the head at the ears, resting them on the ground. Keep the patient's head in alignment with their torso. Be sure that if you are speaking or directing others on the scene, that when you speak, do not turn your body to that individual to make eye contact with someone who may be standing to the side of you. This move could easily tweak the patient's head, which would not maintain the C-spine alignment. Keep your gaze and focus forward in a line with the patient's body. When the rescuers arrive, they will place the patient in a C-spine collar and on a backboard to maintain the alignment. Another complication with the terrain in the preserve is the ability to roll an ankle, which could result in a strain or sprain. There is nothing on scene that can be done but to possibly provide an ice pack and assist the patient off the trail, or call 911 to get the TRT activated to do so. Quite often, this injury for some reason brings out the ego in many with a side dose of embarrassment, and help may be refused. This is where you might bring some negotiating skills into play and provide the fact that there is no fee for help from the fire department. An additional leverage point may have to do with the time of day and season of the year. If this injury occurred on a summer morning when the weather is still cooler at that time, and this patient insists that they will limp off the trail on their own terms, a good reminder is that within an hour or two, the temperature could easily be 20 to 30 degrees hotter, presenting another situation of impending extreme heat. This might help the patient to agree to fire personnel help. A broken bone is a call to 911. If there is a dislocation from a fall on the trail, this too is a call to 911. Suggest that the patient get in a comfortable position if they can find one. This is a very painful injury. Your job is to help keep the patient calm because they are going to be miserable. Bleeding is the #1 priority in an emergency. Depending on how severe the wound is, a person could easily bleed out in a matter of minutes, resulting in a fatality. There is only one way to control bleeding, and that is through direct pressure. This can be done by using a bandana, gauze pads, a shirt, anything that you can place over the wound to contain the blood while applying pressure to the area. If the bleeding does not stop and the dressings are becoming saturated with blood, continue to apply more dressing over the top of the already soaked dressings. Do not remove the dressing to apply a new one. Doing so could cause more bleeding because the coagulating process has been disrupted. Coban wrap is a good tool to hold the dressing in place while applying pressure. This is a stretchy, self-adhering wrap. Many of you might be familiar with it if you have animals. It is used by veterinarians to cover animal wounds. Anaphylaxis occurs mostly when someone has a reaction to a bee sting. Most people who are allergic to stings will carry an EpiPen or choose not to hike if there is bee activity where they are planning to hike. The past way to remove the bee stinger was to scrape it off with a credit card or any other card-edged implement. It was thought that if you grabbed it with your finger to pull it out, that squeezing motion would inject more of the venom into your skin, making the reaction worse. Not so. The sooner you get the stinger out, the less reaction that will occur. Getting out a credit card takes time. Grabbing the stinger immediately does not. The stinger on a bee has a pulsing muscle feature that enables it to pulse the venom into the sting site. This is a choreographed process. Squeezing the stinger will not increase the dose. There are also hornets and wasps that live in the preserve. They are not a one dose then dead insect, but can sting multiple times. Food allergies can also bring on an anaphylaxis condition. This is something to keep in the back of your mind because at any time an allergy can present itself. A hiker one day may be fine with eating an energy bar that contains peanuts, and then the next time doing so may have a reaction to the nuts. The preserve is native habitat for rattlesnakes. Getting bitten by a rattlesnake is a very rare occurrence, but it has happened. Rattlesnakes are pit vipers. This means that they have sensory pits on each side of their nose that senses heat. This heat-sensing ability is what helps them to locate prey. As a human, we are a lot of heat. Snakes do not want anything to do with us as a result of this overwhelming amount of heat that we give off. A rattlesnake knows the drill of sharing the trails. They camouflage well in brush and under bushes. They rarely rattle unless they feel that a person is getting too close in their space and will then do so as a warning. If they could talk, we might hear, "Hey, I'm right here, you're too close." This rattling is a signal to let you know to back off. But they can't talk, nor can they even hear. Staying on the trail is a key to not being bitten. Giving the snake space is a key to not being bitten. Throwing rocks at them is the key to being bitten. A snake bite requires immediate attention. What is called a dry strike may have occurred with a bite where no venom was injected, but there's no way of knowing if this has occurred. This is a type of bite where the fangs of the snake did not penetrate the skin deep enough to envenomate. The venom ports of a snake are located at the halfway point of the fang. If you are on a scene of a rattlesnake bite, the way that you can help is to call 911 and help to keep the patient calm. I know, what a joke. Stay calm after being bitten by a snake isn't probably going to happen. It is very rare that someone has died from being bitten. And if so, it most likely was the result of another medical condition that contributed to the death. Please have the snake bite patient remove any jewelry that they are wearing. There is a good chance that there will be swelling. Rings and bracelets can easily cut off blood flow in this case. Snake bite kits do not do anything to help the snake bite. In many instances, using one of these kits have made the situation worse. The old cut and suck practice has led to severed arteries with intense bleeding as a result. Even given that they are a hoax, REI and other outdoor gear stores still sell them, and they are not cheap either. Applying a tourniquet is another remedy thought to help with managing a snake bite. It is a practice that will make the situation worse. A well-stocked pack is important. Knowing where your supplies are in your pack is even more important. When reloading or organizing your pack after a first aid situation, always put your same supplies back into the same pockets or location. This practice will help your efficiency with the next first aid situation. It's important to stay within your training and comfort level, and 911 is there to help. That is their job. The more questions asked, the better you will be prepared. Emergencies can be stressful. You may see something that is disturbing or sad. Second-guessing yourself is common, and processing the event with someone you trust is recommended. A good drill by which to prepare is to play through what-if scenarios, and any help that you provide is something. Thank you for your participation in Desert First Aid Training.